Hi everyone, welcome to our knee injury prevention presentation. We are Doctor of Physical Therapy students at Western Carolina University, and I'm Taylor Darrow, and I'm a Winston-Salem Steelers Class of 2014 alum.
Before we get started, we want everyone to take a pre-presentation survey. It is not for a grade, but we would like to compare the survey before the presentation with the post-presentation survey just to see how much you have learned. So you can pause the video now and click the link in the description box below to complete the survey before watching our presentation.
In this presentation, we're going to teach you a little bit about knee anatomy, knee biomechanics, the anterior cruciate ligament, also known as the ACL, and how to prevent ACL injury.
So why we wanted to do this presentation is we know that knee injuries are really common in the sport of basketball, and within this sport it requires a lot of jumping and quick cuts, which can cause these knee injuries. Research shows that females are more likely to injure their knees compared to males, and ACL injury is most common. So when you injure your ACL, most likely that will result in surgery, following with a long rehab process after surgery, which can include missing games and practices.
Let's get started with some knee basics. First, we'll talk about the difference between ligaments and tendons. Tendons are at the end of a muscle, and it connects the muscle to the bone in order to move it. An example of this is the Achilles tendon at the back of your heel. A ligament connects bone to bone. An example of this is the ACL, which we will talk about more in depth.
Okay, so there are a number of important bones involved with the knee. So we have the femur, which is the thigh bone, tibia, or the shin bone, the fibula, which is the bone outside the tibia, and the patella, also known as the kneecap. There are also multiple support structures involved with the knee as well. So we have the medial collateral ligament, or the MCL, and the lateral collateral ligament, or the LCL. These are on either side of the knee, and it prevents the knee bending from side to side. We also have the meniscus, which is the cushion between the femur and the tibia.
Now we're going to talk about the leg muscles. It is important to keep these strong in order to protect the internal structures of the knee, such as the ACL. First, we have the glutes, which are the butt muscles. These are a group of 3 muscles that move the leg backwards and turn the leg in or out. Then we have the quads, which are in the front of the upper leg. They're a group of 4 muscles which help straighten the knee out.
Now looking at the back of the leg, we have the hamstrings. This is a group of 3 muscles located on the back of the thigh that help bend the knee. Lower down, we have the calf muscles. This is a group of 2 muscles on the back of the shin. These muscles help point the toe downwards and bend the knee.
So now let's go into depth about the anterior cruciate ligament, or the ACL. Anterior means front and cruciate means cross. As you can see in the picture, the ACL crosses within the knee. There is one ACL inside the knee, which connects the femur to the tibia. The purpose of the ACL is to stop the tibia from sliding too far forward and stop the femur from sliding too far backward.
Now let's talk about how the knee moves. We need to define some important terms. As we look to the far left, we see a normal stance with the legs that are fairly straight. In the middle, it shows a varus stance, also known as bow-legged, meaning that the legs are curving outwards. Finally, on the right side, we see what is known as a valgus position, which is knock-kneed and the knees curving inwards. Abnormal stance, such as varus or valgus, can lead to stress on the inside of the knee, therefore affecting the ACL. Oftentimes, females have more valgus. This is seen in the jump landing and can be due to weak hip muscles or the shape of their bones.
Now let's talk about how ACL injuries happen. ACL injuries can be non-contact type injuries or contact injuries. In non-contact injuries, the player may plant and then cut, causing a twisting in the knee. If that twisting is powerful enough, the ACL can be injured. See the video animation to the left. Additionally, improper landing or slowing down too quickly while running can cause an ACL injury. In contact injuries, A player's leg may be planted when an external force contacts it, such as another player running or diving into it.
So what does this all mean to you? According to the research, females are at a higher risk for ACL injury. As previously stated, this is because females often land in the valgus position with their knees pointing inwards and also tend to have weaker hips. In the past, these injuries have occurred within the Winston-Salem Steelers that have led to missed games. According to our research, we have learned that ACL prevention programs can help reduce ACL injuries up to 53%. And finally, we have also learned that female athletes have been underrepresented in research regarding this topic, and this is where you can help.
We found a very helpful resource for landing progression from Indianapolis Fitness and Sports Training that we utilized for this presentation. For more information, refer to our references. Click the link in the description box below to access our video tutorial containing tips on landing, as well as strengthening exercises, all with the goal of preventing ACL injuries.
This slide is a summary of the strengthening exercises found in our video. The side plank, Romanian deadlift, or RDL, and the single limb squat all will generally work to strengthen the muscles of the leg and, in turn, protect the ACL.
An additional source we've provided is an infographic. This infographic is a summary of the contents in our video, including how many of each exercise to do and other helpful tips. This infographic can be accessed separately in the email sent by your coaches.
These are the big takeaways from our presentation. We want you to know what you can do to reduce your likelihood of injuring your ACL. Refer back to our video tutorial or our infographic to do two things. First, work on your landing mechanics. You may find a mirror helpful or practicing with a teammate to help correct your form. Second, do your strengthening exercises. We suggest performing these exercises before every practice, depending on your coach's preference.
Now it's time to test your knowledge. Please click on the link in the description box below to take our post-presentation survey. These questions may look familiar because they are the same ones from the pre-presentation survey that you completed prior to the presentation. We can't wait to see how much you've learned. Our references are on the following slide. Thank you so much for your time, and go Steelers!